GLP-1 medications like Ozempic are used by an estimated 12% of the US population, but they are now facing scrutiny for a severe potential complication: permanent eye strokes. The condition is called NAION. It occurs when blood flow to the optic nerve is abruptly reduced or blocked, rapidly starving the nerve tissue. This state of visualization breaks down the actual numbers. While observational studies show patients have a twofold higher relative risk of developing this condition on a GLP-1, the absolute probability remains extremely low, about 2 in 10,000 cases per year. Even with that low probability, the outcome is permanent blindness. That level of severity requires baseline awareness and screening for anyone taking these drugs. When NAION occurs, the localized stroke chokes off the blood supply that the optic nerve needs to transmit images to the brain, causing the tissue to die. The primary warning sign is sudden, entirely painless vision loss that typically affects just one eye. This graphic demonstrates altitudinal field loss, how the symptom usually presents. Patients notice the top or bottom half of their vision simply disappears. Another indicator is sudden color desaturation, where the remaining vision in the affected eye appears washed out or gray. Because this specific nerve damage is permanent and rarely improves, waiting to see if it gets better is not an option. Experiencing any of these symptoms requires immediate emergency medical care. Age is the primary demographic factor, with patients over 50 carrying the highest baseline vulnerability for developing this condition. Risk also scales with metabolic comorbidities, like uncontrolled diabetes, high blood pressure, and hyperlipidemia, the exact conditions GLP-1 medications are prescribed to treat. Patients with pre-existing bleeding from diabetic retinopathy, or those at risk for macular degeneration, also face an elevated chance of those eye conditions worsening while on the medication. This cross-section shows the hidden anatomical risk. Some patients have a smaller, naturally congested optic nerve, or calcium deposits called drusen, which physically restrict the space for blood vessels to pass through. Because the average GLP-1 patient possesses multiple overlapping age and metabolic risk factors, proactive eye screening is a mandatory baseline for safely managing these medications. Do not abruptly stop taking your medication, as the cardiometabolic benefits are highly protective. Instead, schedule a comprehensive in-person dilated eye exam. This baseline check needs to happen either before starting the medication or within the first month, followed by routine checkups every 12 to 18 months. This checklist covers exactly what you need to ask your doctor. Is my optic nerve abnormally small? Do I have calcium deposits? Do I have any baseline retinopathy? If you experience sudden vision changes, seek emergency care immediately. If NAION has already caused damage, request a referral to a low vision rehabilitation specialist to help maximize your remaining sight. GLP-1s remain highly effective tools for weight and metabolic management. Safely utilizing them means elevating routine eye care to a critical, mandatory part of your treatment plan.